Hello and welcome back to the Bryan Laskin Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm very excited that you're here because today we are going to be talking about a truth that most people just won't talk about. Let's face it, dentistry is under pressure in a way that I don't think it's been in my entire career. I got out of dental school in 1999, which used to not sound like long ago, but again, then it went to sounding long ago to now it actually is a long time ago. And we are in an aspect of dentistry. I was just actually on a trip with some leaders in dentistry. And frankly, I haven't heard people who are luminaries in the industry be as negative about dentistry as I have in a long time. Not because they're negative people, but because they're realistically reading the tea leaves of what is going on. Margins in dentistry aren't just tightening. It has totally changed where margins in dentistry now have totally changed. I don't believe we're in a season of margins being tightening. They are tightening. Why? Because labor costs have completely changed. They've risen. Consolidation is accelerating. And the truth that most people who are working in dentistry miss is that the biggest growth lever that is the easiest in dentistry, the biggest growth lever that we can add is not adding more chairs. It's not doing more. It's not cutting overhead, which, oh my gosh, have we not focused in dentistry on cutting overhead long enough? And our margins are getting tighter and tighter. So what doesn't work? It's not negotiating supply contracts or looking at saving some money on your bills, particularly dental materials. That has led us to this path right now where we are making less by trying to save more. So what's the biggest growth lever? Not only the biggest growth lever that we have, but the easiest one to pull off, it's clarity. When we allow patients to feel connected, they have clarity in their treatment plans, and they're confident with the care we're delivering, they follow through. And when patients follow through, revenue is what results, right? So that's the operating truth that we're focusing on. If you make people more cared for, you make more. Care more, make more. And today we're breaking down why case acceptance, saying yes to treatment, is an enterprise control problem. If you're one location or 10,000 locations, you have an enterprise control problem that's making you leak revenue through lower case acceptance. Most DSOs think that case acceptance is a doctor problem. And guess what? Doctors think it's a hygienist problem or a communication problem or we need better scripts problem. That is wrong. That is wrong. That is what people have been focusing on. Case acceptance is not a communication problem. It's a control problem. So if you're running one location, 20 locations, 50 locations, 200 locations, 2,000 locations, it might be one of the most expensive problems that you just have. And if you're in multi-site dentistry, you know this because you see variability. That is your enemy. And guess what? If you have one location, you don't even know where you are on the scale of variability. That's the scary bit. So if you have a multi-site practice, DSO, variability is the enemy. Predictability is the asset. You want to focus on predictability. And case acceptance is one of the biggest drivers of predictable revenue. So here's what most leadership teams do when case acceptance is lower, when they have a variable that's low. They blame providers or the front desk. They blame the economy. Oh my gosh, like I just started this off. Margins are getting squeezed. Guess what? Can't control it. They blame patients shopping around, or they roll out some training program. They bring in a consultant. They teach scripts. They run a workshop. 3 months later, nothing changes at scale. Have you done that? I bet everyone listening to this has brought in a trainer, consultant. They've worked on scripts. They've had a workshop. Everybody's all fired up. And then 3 months later, nothing changes or you have very little change. Why? Because you cannot train your way out of a systems failure. If your systems are failing, you're going to rely on people to solve them. And that, my friends, is not consistent. Case acceptance isn't a persuasion event. It's an outcome of patient clarity. I'm going to say that again. Case acceptance isn't a persuasion event. It's an outcome of clarity. Clarity isn't a personality trait. It's a system. Case acceptance is not a sales skill. We're not selling. It's a clarity system, giving people clarity. When patients decline treatment, most leaders interpret that as resistance. In reality, it's usually confusion. Patients aren't rejecting dentistry. They're rejecting uncertainty. They hear you think that they hear you need a crown. But what they feel is, I don't even understand what you're talking about. I don't know what that means. I don't understand how urgent it is. I don't understand what happens if I wait. And I don't usually understand why it costs what it costs. So whenever I'm talking about case acceptance, people always bring up cost. Cost is just a function of value, and value is a function of clarity. If they knew what we knew, they would say yes as much of the time, as long as they physically can finance it, get financial clarity. There's another big piece, right? And when humans don't understand, what do? When humans don't understand, they delay. And delay looks like rejection, but it's usually fear. Confusion is the most expensive emotion in dentistry. Confusion is what's causing leaks in your revenue. So now let's layer scale on top of this, right? All of this confusion and lack of clarity, as you scale multiple practices, you just don't have a case acceptance problem, right? You have 50 different versions of case acceptance, right? Case acceptance in one office is totally different than another one because you're relying on human beings to do it. One office may explain clearly, they're a rock star. One office rushes. Another one has a confident assistant that maybe she leaves and a new assistant comes in. One has a burned out team. When one office reinforces urgency really well, one office unintentionally undermines urgency because they're treatment planning the patient's pocketbook, not the patient's mouth. Then you in leadership think that you're running one business, but you're running dozens. It's an enterprise control problem. If you, as a dentist, aren't making a decision on getting control of case acceptance by systematizing it, you're making the decision to have chaos. So let's put enterprise math on this, because this is where it becomes undeniable. If you have 100 locations and each one is losing even $20,000 a month. So if you have 100 locations and each one is losing $20,000 a month in unaccepted diagnosed treatment, that's a $2 million per month problem. Just $20,000 a month. That's not much. Per location at 100 locations, you're leaking $2 million a month. That's $24 million every single year. And here's the part that executives hate. That loss, invisible. The number of times that people bring up spreadsheets and they pretend that the spreadsheets tell the story. One of my favorite new quotes I just heard, it's easier to lie in Excel than in Word. And here it's not even lying. It's a lie by omission. This loss, this $24 million a year due to lack of clarity from patients' minds is invisible because it doesn't show up as a line item called confusion. It shows up as lower production, lower predictability, lower EBITDA, and lower valuations in your enterprise. If it's a $24 million a year problem, that's a $240 million loss on your next turn. Private equity in dentistry doesn't just buy dentistry. It buys predictable cash flow. And case acceptance variability is the opposite of predictable cash flow. So if you show consistent case acceptance, it increases your valuation. If your case acceptance in your enterprise depends on which provider a patient happens to see, you don't have a business system. You have a roulette wheel. So let's talk about the part dentistry consistently underestimates. Most dentists assume that case acceptance happens chairside, but that's not the case. The real decision is often made at home. The patient leaves, and guess what? They're not thinking about you. They forget. They talk to their spouse. They Google symptoms and negative outcomes. They see the horror stories. They get distracted, and then they start really worrying about money. And the practice has no system to maintain the confidence, even if you are able to have that rock star human being that builds urgency and clarity for patients in the office. As soon as they leave, it breaks down after the visit. Dentistry thinks that case acceptance happens in the operatory, but it doesn't. It happens in the kitchen. And a single practice, if you have a single location, if you're a charismatic doctor, you can actually overcome broken systems. But charisma does not scale. Systems scale. And in a DSO, personality cannot be the operating model. You can't hire your way out of this problem. Enterprise control must be the operating model. So what's the fix? What's the fix to all of this? Stop treating case acceptance as a persuasion problem, as a training problem, and start treating it as an enterprise clarity system. Now, this is where the care more, make more operational model comes into play. Care more, when we talk about this at Tooth Apps, it's not a soft language. It's an operational language. The care more pathway includes three things: connection, which leads to clarity, which leads to confidence. Connection means that the patient feels seen, not processed. Connection lowers resistance, and patients feel cared for, which causes them to not shop just in the same way, right? If they feel cared for, they look at things differently. Clarity means that the patient understands what's happening, why it matters, what happens if they delay, what the costs are, what the transparent costs are, and what the next step is. Clarity is not a script. It is the way we automate our delivery system to patients. Now, confidence is what makes people act. And confidence is very fragile. It evaporates after the visit if you don't reinforce it. The best organizations don't just explain dentistry, they reinforce certainty. When you systematize connection, clarity, and confidence, predictable outcomes follow. Revenue increases because people accept treatment. Your recall stabilizes and shortens because patients return more regularly. Why? Because they have that connection, so they will return. And referrals grow because confident patients tell others. That's how we get to the make more and the care more, make more economic model. Revenue, recall, and referrals. And the DSOs that win this decade are not going to be the same ones of past, right? They're the ones that prioritize standardizing clarity. Case acceptance is not about convincing patients of anything. You don't have to sell them anything. It's about removing confusion. Case acceptance is about removing confusion, and confusion at scale is not a chairside issue. It's an enterprise failure. And I know it's hard to hear that if you're at the enterprise level. Confusion is not a chairside issue. It's an enterprise failure. And if you want to know whether you're actually managing this like an enterprise, here are three questions that every CEO, if you're in a leadership position at a group of practices, here's three questions you should ask your team. Number one, what's our case acceptance variance across locations? Do you know it? Take the top one and the lowest one, and what is our case acceptance variance? What happens to patient confidence after they leave the office? What is our follow-up workflow after patients leave the office? How do patients actually have access to their intraoral photos so they can show that picture of that crack that convinced them when they were chairside, but now we have to show it to their spouse? And can we prove that our treatment explanations are consistent enterprise-wide? Treatment explanations being consistent worldwide. How can you actually do that? If you can't answer those questions, you're actually not managing case acceptance, you're observing it. You look at a dashboard and you see what happens and you can't do anything about it. And you hire a consultant thinking that you're going to do something about the problem, but thinking about doing something about the problem isn't the same. Hope doesn't scale. Training alone doesn't scale. So what does? Systems scale. That's the operating truth behind Care More, Make More. And it's the difference between production volatility, enterprise predictability. So I hopefully you got this. I think this is, if you're running a DSO today, listen again. I think that what we're talking about with case acceptance and clarity is massive. So until next time, remember, operations that care more, make more. Thanks again, and see you next time right here on the Bryan Laskin Podcast.